What about my co-occurring psychiatric disorder, you say? Well, as it turns out, patients with substance use disorders are very likely to have co-occurring psychiatric disorders. Now, does that mean my depression caused my alcohol use disorder, or that my alcohol use disorder caused my depression? Does it mean that they both have the same root cause? Well, no, not exactly. Although both disorders, for example, depression and alcohol use disorder, are brain-based disorders, um, they are not one and the same. One does not necessarily cause the other. However, they do aggravate each other. And about 50% or perhaps even more of patients with a substance use disorder have a co-occurring psychiatric illness. I'm not going to talk extensively about that. We do see a lot of patients with these disorders, and so we assess them and manage them appropriately. But we have to remember that the classes of drugs that patients are using often have major psychiatric effects. For example, patients who are using a lot of methamphetamine come into treatment and they're usually profoundly depressed. And this is the direct result of heavy stimulant use. When you are using a stimulant heavily and you take the stimulant away, depression is expected, it's universal. And so patients come in with significant depression. Alcohol is a depressant, and it is a relatively long-acting depressant. So when patients come in with alcohol use disorder and complain of depressive symptoms, we don't know for sure whether they have actual major depression or if they have alcohol-induced depressive symptoms. Of course, the symptoms clear up with time if it's alcohol-induced, but many of the patients also have co-occurring major depression, and we have to give them time to see where they settle out. A lot of patients come in being treated for various psychiatric illnesses, but they've never been evaluated during a period of abstinence. And if that's the case, we really don't know whether they have a psychiatric illness co-occurring or not. And one of the advantages of bringing folks in and having them live in this environment for a while, it gives us a chance to evaluate them over time. And we can see how these disorders and symptoms either resolve or don't resolve while they're here. Therefore, we are well armed to figure out what's next. Do they need a major workup for a psychiatric illness, or do they just need some supportive care while their brain is recovering? Folks generally don't realize how much actual damage these chemicals cause inside the brain. We don't have lab tests, for example, that might show brain damage, like we can show liver damage or bone marrow damage that we can show with alcohol use disorder, for example. And yet I know that the brain is much more susceptible to the damage than, say, the bone marrow or the liver is. So we assume when folks come in that they have some of this type of damage. Much of it will resolve, but we don't know until we've given it some time. And so that's one of the great advantages of treatment here, is we get patients the opportunity to have the time to complete this evaluation and determine whether further psychiatric treatment is indicated or not. And just so you know, and this gets a little bit into what we call models of addiction, we don't believe in the psychological model of addiction here. We don't believe that alcoholism and drug use disorders are the result of some deep underlying psychological problem. The reason we don't believe that is because if you treat folks that way and you tell them, okay, you have this underlying psychological problem, you weren't hugged enough when you were a baby, or whatever psychological trauma from the past you had, once we get to the root of that, you won't want to drink anymore, or you won't want to use drugs anymore. Well, that's completely false, because they don't want to drink or use drugs because they had a difficult childhood. They want to drink and use drugs because they have the disease of a substance use disorder, okay? Many people with a difficult past and trauma in their life do not develop substance use disorders, okay? It's not a causative agent. It may promote it, it may aggravate it, but it is not the cause of it. And so we don't approach psychological problems as the cause of substance use disorders. Now, many of our patients have these psychological disorders, and many of them have trauma. Half to 2/3 of our female patients have major trauma, either physical, emotional, or sexual abuse. And we address that, but we don't say, okay, you drink because you were sexually abused as a child. No, that's not true. And a lot of people will use that as an excuse for why they continue to drink, when in fact we need to treat that psychological, emotional, physical, and sexual trauma. We absolutely need to treat it, okay? But we also need to treat their substance use disorder separately, and that's what we do here. And again, being in treatment gives us the opportunity to evaluate these folks in a timely way, so that we can determine what the best course of action is. That's all I got to say about that.